Hi everyone! Today I would like to present you a study about human fascia lata. That is a connective tissue with a multi-layer organization, also known as aponeurotic fascia. Fascia lata biomechanics is influenced by its composite structure, formed by fibrous layers, usually two, separated by loose connective tissue. In each layer, most of the collagen fibers run parallel in a distant direction, with an interlayer angle that usually ranges from 75 to 80 degrees. These collagen fibers are arranged according to individual loads, thus defining the biomechanical properties of fascia lata and mirroring the fascia's ability to adapt and withstand specific tensile loads. Its relative known cellularity and low nutritional requirements make these connective tissues suitable for grafting. Although an allograft obtained from fascia lata have been used for many years in the surgical treatment of soft tissue repair or reconstruction in many clinical fields. Thus, with this study, we want to characterize the isotropic, viscoelastic, fiber-reinforced composite material of fascia lata to highlight possible differences between layers' contributions. Fascia lata was harvested from the anterior compartment of the thigh. The multiple samples were cut, oriented, and loaded during testing, according to the direction of the main collagen bundles for each individual layer, also called longitudinal, and the relative orthogonal ones, also called transverse. Rectangular samples were positioned on rigid C-shaped support and fixed, and thickness was measured in at least 3 points with a manual caliper. Once the support with the sample was anchored to the machine grips, the support was cut to not affect the mechanical test. Tensile tests were performed on samples of fascia lata to observe possible influences of fibrous orientation in tissue behavior. In a nutshell, a preconditioning was performed prior to failure test to achieve a repeatable and stable response with a small underbreaking tensile load with a cyclic tensile test. Then, after a resting time, failure was achieved with a specific strain rate. The uniaxial fascia lata response exhibits the standard behavior of soft connective tissues, with increasing stiffening in the first part of the curve, also known as toe region, up to almost linear region, where young modulus values are obtained. That leads until the progressive breakage of the microstructure up to failure. Among subjects, the fascia lata exhibits strain at break values that ranges between 8.4 and 23.2%, with ultimate tensile strength that spans value ranging from 0.5 to 12 megapascal, with strong differences between directions, also confirmed by young modulus values that result also 28 times higher when apply a load in one direction than in the other one within the same layer. For each subject, one layer results to be stiffer than the other, confirming a clear difference between layers, where the stiffest one supports the greatest load. Thus, uniaxial failure tests on fascia lata samples revealed an anisotropic behavior according to the interlayer angle. The more the interlayer angle is close to 90 degrees, the more the two families of fibers are almost orthogonal between them. Thus, collagen fibers orientation with respect to the imposed displacement plays a key role. This behavior could be motivated by the different functional roles played by the two layers in terms of connection between knee-hip axis and adaptation to the muscular contraction and volume variation during daily living activities. These results could support clinical practice, for example, guiding surgeons during graft preparation and placement, physicians in risk assessment after surgery, and physiotherapists during musculoskeletal rehabilitation as manual therapy, and engineers for in silico modeling towards personalized and site-specific medicine. Thank you.